Hello, everyone, and welcome back for another episode of the Down Syndrome Center of Western Pennsylvania podcast. As always, I'm your host, Dr. Kishore Vellody. And today we're going to be trying something a little new by having our guest actually be a part of our show over the telephone. And we're joined today by Dr. David Stein, who's a psychologist that many of you may recognize as the author of the outstanding book, Supporting Positive Behavior in Children and Teens with Down Syndrome, the Respond But Don't React Method. And I personally know how popular Dr. Stein's book has been because when it was first released in the summer of 2016, we tried to buy a whole lot of copies from our Down Syndrome Center to be able to distribute to families. But boy, they were selling out like crazy, and it took us a long time to be able to get some books. But anyway, I went and I checked today, and it looks to actually be 32% off that list price on Amazon. So feel free to go and grab a copy after the podcast today. But Dave, we are really honored to have you as our guest today. So thank you for joining us.
Thank you. I'm happy to be here.
Well, usually when we do our podcast, Dave, we usually start off with a little bit of background for our listeners, a little bit maybe about your training background, your work with people with Down syndrome, your interests, how they got to be around Down syndrome as well.
Sure. So we have to go back quite a long way. When I was growing up in the Boston area, my mother's best friend, who I referred to as my aunt, was a coordinator of disability services for the community center. And my mom was a special ed teacher, as is my sister. And so through my, family friend or aunt's role, we as a family spent a lot of weekends kind of at disability fundraisers and events for people with disabilities, many of whom had Down syndrome. And that was just kind of a part of my childhood. It didn't seem, out of the ordinary in any way to me. That was just kind of what we did. And I really enjoyed it. So I think, just maybe genetically or based on my family experience, certainly was predisposed to wanting to work with kids and with kids with disabilities. I did my training all in the Boston area. I'm a typical Boston guy that can't seem to get out of here. And so I went to Tufts and then William James College, which is a small school around here, a doctoral program in psychology. And then I did all my training through Harvard Medical School. And my fellowship was at Boston Children's Hospital, where there is a very long-standing Down syndrome program. And so after my first year of a 2-year fellowship, my boss came to me and said, "Do you have any interest in working in the Down syndrome program?" I had a lot of interest for a few reasons. The first reason is that I had, a lot of positive memories and experiences of spending time with people with Down syndrome and just had a very positive feeling toward this community. And another reason is that I really wanted a job. And when the boss offers you an opportunity to do something that no one else is doing, you certainly want to jump on it. And then the third reason that I really was excited about the opportunity was that nobody was really doing it in our area at that time. There are certainly psychologists that have been working with people with Down syndrome for a long time, like Dennis McGuire, who wrote the Mental Wellness in Adults book with Mental Wellness in Adults with Down Syndrome book, along with Brian Chicoine, which is an excellent resource. But there weren't many people in Boston doing this type of work. And so it was really exciting because as a postdoc in my second year at the hospital, we kind of opened the floodgates to families of people with Down syndrome who were looking for help with behavior and also with neuropsych testing, both of which I was doing at the time. And before we knew it, the wait list was, a mile long. And we were always trying to manage that and just adding people and adding resources and adding my time. And the demand just kept growing. So not to skip ahead too much, but really what the book came out of is that the demand for an understanding of people with Down syndrome and how they behave and what helps people do their best was so great that I felt like I just could not ever possibly get to all the families that I wanted to get to. And so that was kind of what led me to want to write something that could be accessible to more families.
Yeah, that's fantastic. I think that background and then coming into an area where really you're right in terms of pediatric behavioral management and Down syndrome, there really wasn't anything. And your book comes out, and it's perfect for families and also for practitioners to get some really great advice. So what I was hoping to do during this podcast is I'd like to just kind of present a few scenarios to you. I'd like to get an idea of how your approach would be. But before I get to the specific scenarios, give us a little bit of an idea of the general kind of this respond but don't react method. Like, what does that mean?
Sure. So, as you know, Kishore, and I'm sure many of you listening also know, on average, tend to be very sociable. And there are certainly exceptions to that, but that's kind of a theme. Mm-hmm. And that can be a positive thing in many ways. People are often, with Down syndrome, are often very fun-loving and very responsive to others. So it's really rewarding to spend time with people with Down syndrome generally. There are some challenges, though, that also come out of that difference in the way that the brain works in people with Down syndrome. And one of those challenges is that people with Down syndrome can read others' emotions really, really well. And there are studies that show that infants and newborns with Down syndrome actually read other people and respond to other people better than other kids who are born without Down syndrome. So there is this kind of hyper-social attunement, or what I like to call the social and emotional radar, in a lot of people with Down syndrome, which makes them very, very sensitive to other people. So that can be a good thing when you're giving lots of positive feedback and you're showing positive emotion. But unfortunately, when people have behavior challenges, which are very common in Down syndrome, we adults especially tend to show a lot of negative emotion. And we tend to show a lot of negative emotion exclusively. So we tend not to notice a lot of the good behaviors that come along when someone is struggling mm-hmm. and we're frustrated. So what can happen is that when we're showing a lot of that negative emotion, people with Down syndrome can become very aware of that and start to feel that, the only way I'm going to get a reaction from the people I love or that I'm interacting with is to do some negative behaviors. And so what the respond but don't react method is really about trying to kind of be more aware of our emotional reactions to the behavior of people with Down syndrome, and to kind of harness that as the main way that we're giving feedback, because it's the most powerful reinforcer and also the most powerful punisher that we have. And punisher is a behavioral term. But as an example, it's going to be much more rewarding to someone with Down syndrome to get a high five and praise and a lot of eye contact and positive emotion than it is to be given a toy, for example. And similarly, if someone is not doing what we want them to do, it's going to be much more powerful to look away and to ignore them than it is to punish them or yell or, give a really stern timeout. So it's really our social and emotional feedback and our response that can be the most powerful way to shape the behavior of someone with Down syndrome. And in turn, we have to be really careful that we're not reacting emotionally without being aware of it in ways that could inadvertently make behavior worse.
Yeah, that makes sense, and I think certainly those types of responses are what we're often asked about in our clinic visits. Well, why is my child acting like this when I don't want them to. And I think one of the nice things, actually, one of the great things about your books is how you go through so many of the common scenarios. And I was just thinking about the patients I've seen in the last couple of months, and I came up with a few stories that I was hoping I could share with you, and then you could help us kind of give us your thought process of how you would walk through that. Would that be okay?
Sure, of course.
All right, great. So the first one, we have fake names, but the first one is John. John is an 8-year-old boy who's always had some oppositional behaviors at home, it seems, but it seems to have increased more during this recent school year. It seems almost like anybody with authority is getting his favorite response, which is now the word no, whenever they ask him to perform a task. So what would be your approach to kind of assess and manage this type of what would seem to be oppositional type behaviors?
Right. Yeah, so it's a great question because the kind of gut reaction to a child saying no is that they're being oppositional and that's what's driving the behavior. I look at that a little bit differently and say, well, this 8-year-old boy is starting to exercise his independence and show us that he has some opinions of his own and that he wants some control. And I always think about, when you're an adult and you're frustrated, you want that child to do what you want them to do right then. Mm-hmm. But when we think about what we want for children long term, we want them to be independent. We don't want people to push them around. We want them to be able to advocate for themselves. So I see this as John, in a healthy and normal way, pushing back and saying, no, I want to say. And so the first thing that I always think about with this type of situation is how can we offer John some control? How can we kind of honor the fact that he wants to have a say in what he does? And so the first way that I always think about doing that is to offer John choices. So instead of just saying, okay, John, it's time to brush your teeth or it's time to clean up, to which he's going to say no, we offer him two choices of things that are both acceptable. So, okay, John, do you want to brush your teeth first or do you want to wash your hands first? And then he makes the choice. And it's amazing. It's such a simple strategy, but when you give kids choices, it undoes that power struggle that you're in where you're saying do this and they're saying no. All of a sudden, the child is feeling like, oh, I have a say here. And in a very high percentage of cases, I can't give you an exact number, but in my experience, we have a very high success rate of offering kids choices, and all of a sudden there's no power struggle. The child feels like they're in control, and we get through the task much more quickly.
And I think you hit on it, and I just want to make sure our listeners hear it too. I mean, it sounds to me like the choices you're giving are two options that either way or either one would be fine for the parent or the teacher who's asking. I find a lot of times that the families will instead say, "We're going to go to the store. Is that okay?" Now, is that right? That type of choice? I think would end up backfiring, wouldn't it?
Exactly right. You want to offer two acceptable choices, and you want another strategy is in terms of your language. You want to give clear directions, and they are directions. They're not questions, right? So if you ask the question, "Is it okay if we go to the store now?" or "Do you want to go to the store now?" you should expect that a developing child who's asserting their independence is going to say no. Mm-hmm. But like you say, Kishore, if you say, "We're going to the store now," right? And then you might add, "Do you want to put on your shoes first or put on your jacket first?" right? You are going to get a very different response based on how you present the situation, rather than offering a choice of, do you want to go or not? That's
great. All right. Well, thank you. And as always, for our listeners, there's a lot more information, a lot more detail about these types of behavioral issues that come up that you'll be able to find in the book. So Dave, let me give you another scenario, a totally different one. This is Sarah. Sarah is a 12-year-old girl, and she seems to have challenges in public settings, especially at the grocery store. It seems that every time her mother brings her to the store, she's even having a hard time getting her out of the car when she gets to the grocery store. And then when she's in the store, she does this thing where she'll fall to the ground and refuse to move. And those of us with loved ones with Down syndrome like myself, we always called this the stop and flop. And it was great to see that a chapter in your book or a section of the book was actually called Stop and Flop, because I remember this very well with my brother when he was younger. So what's your approach to this? What would be your approach or suggested approach to this type of situation?
Sure. So that's a more complicated one that I think we can go into briefly, and then there will be a lot more information. There's a whole section on this in the book, and we could probably talk about stop and flop all day. The big one is that we always want to be forward thinking. So we always want to think about what's next, which tends to help all kids, but especially kids with Down syndrome. A lot of times, the reason we see kids flop to the floor or refuse to do things is because they're scared or they're anxious. And for example, the grocery store is a loud, chaotic place. I can feel the kids' pain because I really don't like going to the grocery store myself. So what I like to do is to say, well, what are the positive things that we're going to do? What can you think about? So we want to give Sarah a preview of what's coming. So we might do a little chart or a social story, which is just, a few pages of, construction paper with pictures of what's going to happen. Or we can use apps like the First Then app, which you can create a visual schedule on the fly. And we basically want to set the stage. Okay, Sarah, we're going to get to the store. We're going to walk, we're going to hold hands through the parking lot. We're going to walk into the grocery store. And then the big thing that I love to do in public settings is to give the child something to do, right? To make it a positive experience. So to say to Sarah, here's your grocery list, right? I have my grocery list, but you need to look for these few items. And I would scatter them around the store, right? And then maybe add something in. If you find all your items, or when you find all your items, then we do a prize, right? Then we do, we listen to your favorite song on the way home, or something along those lines. But it's always kind of like, what's next? And we're previewing, which takes the anxiety down, and then you see a lot less avoidance. You see a lot less of the stop and flop and refusing to move kind of thing.
Okay. Yeah, that seems to, that's awesome. That's great. I like that idea. Would you mind, for the listeners, what was the name of that app again, and how do you spell that?
So it's called the First Then Visual Schedule app is the one that I have used. So First Then and then Visual Schedule app.
Oh, fantastic.
And there are some different options that you might want to, check them out in the App Store. But that's the one that I've seen and looks pretty good to me.
That's great, yeah, because I know that electronic devices in general are, for kids these days, are a real motivator in terms of being able to use that to learn. And boy, for kids with Down syndrome especially too, they seem to have a particular aptitude many times for a lot of those devices. So that's fantastic. Well, can we do another one?
Of course.
All right, let's do one more, and we may have to think about having a second podcast with you as well. But let's try this one here first, and see your thoughts on this. So this will be Mike. Mike is a 4-year-old boy, and he loves attention, but for really unclear reasons, he just loves to open doors and run away. And his mom is totally at a loss, and she says, it seems that he would be losing attention because he's leaving the family, or sometimes he does it at school, so he's leaving the teachers and his classmates behind when he runs out the door. So she's not sure why he's doing this. So what would be your thoughts, and how would you counsel this mom?
Right. So the first thing that I would tell Mike's mom is that it's a very common behavior, especially in young children with Down syndrome. And it usually does get better over time regardless, because impulse control gets better over time. Impulse control is really challenging for young children with Down syndrome because of differences in the frontal lobe development. So in the meantime, we just have to survive and try and figure out how to manage this behavior. So there are a couple of things that I would do. The first one is that you really have to control the environment. So we want to find safe ways to keep doors locked, in a way that doesn't put anyone's safety at risk. Mm-hmm. But for example, if you have locks at home, on your front door, you might need to install one that's higher up if Mike has learned how to undo it. So just kind of trying to keep the environment a little more controlled can help. We also want to give some visual cues because children with Down syndrome tend to respond much better to visuals than they do to like verbal commands. Mm-hmm. So Mike is probably going to do better if you can put a nice big stop sign on the door rather than if every time he runs the door you yell stop. Mm-hmm. Right? So some visual cue would probably be helpful. And then if the behavior happens when Mike does run out of the house, this is where that term respond but don't react actually came from. It was from so many conversations I had with families about bolting. And the big thing that I would hear from families is my child runs just like with Mike and they think it's a game and we're running after them and we're screaming and we're yelling and threatening to take away their iPad for the rest of their life, and nothing seems to matter. And so what I often point out to families is, that strong reaction, that emotional and social response where you're running after them while ranting and raving with lots of eye contact and a lot of emotion is making this behavior very, very fun and rewarding. Even though you're upset and you think you're showing negative emotion, it's still very exciting for a young child who is really socially engaged. Mm-hmm. So this is where I say it's very challenging to families, but you run after Mike and you make sure he's safe, regardless of anything else. You have to make sure he's safe. But when we are running after Mike and making sure we get him so he stays safe, we are not making lots of eye contact, we're not talking a lot, and we're not showing a lot of emotion. So I run after Mike. I would, hold his hand or hold his arm to make sure that he's safe. I would not look at him. I would look away. I would stay very, very calm, and I would say no running, and that's it. And not make it into a big production because we don't want to make this a fun thing that the next day he's going to look forward to doing. So we have to be really careful that we, again, don't inadvertently make a behavior more fun and interesting by getting really worked up and reacting to it emotionally.
Yeah, and I think that was definitely one of the more kind of powerful chapters in the book, because you talk about how it really is the parent's job is to keep the child safe and to go and get him or her from whatever danger might be outside. But there's no rule that says that you have to respond emotionally, and I think that was really an empowering kind of idea in that chapter of the book. So Dave, I think this is kind of all the time that we have for today's podcast, and you've been very generous with your time in answering these questions. If you're okay with it, I'd love to connect again with you soon for another podcast. Would that be all right?
That sounds great. Awesome. Absolutely.
Well, great. Well, thanks. Yeah, well, for our listeners, like I said, we'll be recording another podcast with Dr. Stein very soon, and we're going to discuss other behavioral scenarios, and we'll ask Dr. Stein to walk us through his thought processes. And obviously, like I said, we're only scratching the surface on the detail that Dr. Stein has in his book. And again, that book is called Supporting Positive Behaviors in Children and Teens with Down Syndrome, the Respond But Don't React Method. And it is available wherever you find your favorite books. But until next time, goodbye.